Hey there, Warhawks. It's Mr. Brummelsmith here, coming at you from the man cave at the Brummelsmith household in Kenosha, Wisconsin. I'm here to talk to you about all the measures you can take to protect yourself from the coronavirus, why you should do them, that sort of thing. You'll notice, of course, that I am wearing a mask. Now, I don't need to wear one down here. I'm the only one down here. But masks are very important. Not only do they prevent you from spreading the disease to others, but they prevent you from catching that disease from other people as well. You remember that we learned that viruses are non-living organisms. They need a host in order to live. You are a host for COVID-19, the coronavirus. So you want to make sure that it doesn't get inside of you. You should wear a mask every time you go out. Every time you're around someone who does not live in your house, you should be wearing a mask. Now let me explain to you guys why. Here's why. Let's assume that every time you come in close contact with somebody else who has the coronavirus that you're going to catch it. Let's assume you're going to catch it 100% of the time. You're not going to catch it 100% of the time, of course. We're going to assume that you do. If you're wearing a mask and that person has the coronavirus, rather than you catching it 100% of the time, you're only going to catch it about half the time. So it's twice as effective to have the mask on than to not have the mask on. So for protecting yourself, it's very important. Now, if the person who has the coronavirus is wearing the mask, you only have about a 20% chance of them transmitting that virus to somebody else if they're wearing a mask. There is still a chance that it's going to happen, but rather than a 100% chance in this scenario, it's only about a 20% chance or so. If both of you guys have masks on, if the person who has the coronavirus and you both have masks on, you go from a 100% chance of catching it in this scenario to about a 1% chance of catching it. So wearing a mask is extraordinarily important to try to defeat the coronavirus. Wear a mask as often as you can when you go out in public, not only to protect yourself, but to protect other people. Because you might say, but wait a minute, I don't have the coronavirus, Mr. Brummelsmith. Well, how do you know? Only about 1% of Americans have been tested for the coronavirus. Young people, like yourselves, and still me sort of, can be what's called asymptomatic. That means they don't have any symptoms. You could have the coronavirus and not know it. So the people you come in contact with, you are likely to pass it on to them. But if you're wearing a mask, the chance of you passing it on to other people goes down tremendously. It's also important to note with these masks that if you're making your own, it has to have at least 2 layers to it. The reason is that when you're making your own, you're probably going to use a fabric. Fabric is porous. That means it has holes in it. The virus can get through those holes. If you have 2 layers, now the chance of those holes matching up goes down significantly, and the virus is much less likely to get through. If you're using a reusable mask like this that you can wash, you should wash it after you get home every single time and try to avoid touching it with your hands because the virus can get caught on the surface. It can survive for a little bit on the surface. So try to remove it if you have gloves on or something like that, or wash your hands directly after doing that and wash it every single time you use it. If you have a disposable one like this, you should be throwing these away every single time you use them, basically. Try not to reuse these unless you don't have a choice. If you only have one of these, you know, the ability to make or buy these masks, then go ahead and try to use these again. But again, avoid touching them with your hands because now the virus can get on your hands. And if you go ahead and touch your nose, your mouth, or something like that, you can get yourself infected. So be very careful about the masks. That's really important. You also should be wearing gloves when you go out in public. This is to protect you from getting the virus on your hands. And if you have the virus on your hands and then touch your face, you now can have the virus. It's important to wear gloves when you're going out in public so that you can't transmit that. However, if you're touching your face with the gloves, that's not terribly bright because the virus, again, is going to be on the gloves. Just like we learned about in class with contamination, you have to assume that the outside of your gloves are going to be contaminated. So if you go around the store and you're touching things with your hands and stuff like that, that's okay. You can do that, but just understand when you get home, you should try to wash everything that you should wash. You should try to be using hand sanitizer, and don't wear the gloves all day long. The gloves are going to protect your hands from getting the virus on them, but that's not going to do you any good if you wear them all day long and are going about your daily routine. If you wear the gloves to the store, get the virus on your hands, come home with the gloves on, and now are touching stuff in your house when now the virus is on the stuff that you are touching. So do not wear your gloves all day long. When you remove the gloves, you will remember, we taught you guys how to do this in class, you have to assume that all of the outside of the glove is contaminated and that your hands inside the glove are not contaminated. So if you remember how we remove the glove, we get down by the heel of your hand and we're going to pinch that. Again, contaminated glove can touch contaminated glove, that's no problem. You're going to slowly work its way up. Try not to flick it. Take it off. You're going to hold that in one hand like this. Now, we do not want to touch the outside because our hands are not contaminated. So what we are going to do is we can touch skin to skin. That's fine. And we're going to put it underneath like that. And we are going to carefully take off the glove. The inside of the glove should not be contaminated. Get this and throw it away. Make sure you don't throw it away at the very top of a full garbage can where you're going to put something else in there and touch the glove. Throw it away. If you got one of those Walmart bags or something, wrap it up in that, throw it away, because you got to consider that this is going to be contaminated. You should be using gloves when you leave the house, but you should not be reusing them. They're called disposable gloves for a reason. In addition to doing all that sort of stuff, you should be using hand sanitizer or soap as often as you possibly can. I've got this little spray bottle here. I keep it in my car. So when I come in, I just go ahead and give myself a nice squirt with that. And that is going to take care of the virus. Hopefully, if the virus is on my hand, I will have removed it. This is certainly not 100% effective, but it is about 99% effective. So that's pretty darn high. Do that as often as you can. Everyone's doing that now. You're not going to look that weird doing that. So try to make sure you have that with you. When you're at home, wash your hands as much as you possibly can. Certainly if you're going outside or to a store, if you have to, you need to be washing your hands. Most stores are providing you with that stuff. Take advantage, use them, okay? Also, as far as social distancing goes, the CDC, Center for Disease Control, recommends that you stay 6 feet apart from people. That doesn't mean that it's okay to go to your friend's house and hang out with them as long as you stay 6 feet apart. Those guidelines are for necessary trips that you have to make to the doctor's office, to the grocery store, to work if you're considered an essential worker. You're supposed to take all these precautions I just mentioned and stay 6 feet away from other people. That means if you're going for a walk outside, the sidewalk is certainly not 6 feet wide. You're going to have to move to the side. Somebody's going to have to if you're going to walk by. It doesn't mean you go hang out at your friend's house as long as you're 6 feet apart. You go have a barbecue as long as you're 6 feet apart. You should not be doing those sorts of things. You absolutely should not be doing those sorts of things. Do you understand me? Stay at home. Stay safe. What we're trying to do is what we call flattening the curve. What that means is that as we keep contacting other people, the virus will spread. This virus is proven to be very resilient and it is spreading at a very rapid rate. The reason we are staying at home is so that we can stop the virus from spreading. The virus is still going to spread even with all these measures. Inevitably, it's still going to spread to a lot of people. Let's say for the sake of argument, we have 100,000 beds in hospitals. We've got much more than that, but let's say that we have 100,000 beds in hospitals. If we did not do social distancing, those beds would have filled up very quick within a matter of weeks. And then if we still don't social distance, you're going to have more and more people. We are not going to have enough. If we know that we can do social distancing, which is going to prevent a lot of people from getting the coronavirus and also delay when certain people are going to get the coronavirus, now we stay under the threshold that we have for hospital beds. Because if we have too many people trying to go to the hospital at once, it gets overloaded and that curve goes up. We want to flatten the curve by staying at home, practicing these social distance guidelines, so that when you do, if you do get coronavirus, which they estimate more than half the country, even with these measures, eventually is going to get it. This is not going to end next week. I hate to be pessimistic. I'm just doing projections here. but a lot of people are going to get this virus. Rather than having everybody get it at once, overloading the system, lots of problems, which is going to lead to more deaths and more serious issues with this, they would rather spread it out, reduce the amount of people getting it, and reducing the amount of people who get it at a certain amount of time in order to not strain the system that we have going on here. If you guys have any questions, of course, you can always send me an email. I'm available anytime for emails or anything like that. Hopefully this information was good to you guys. Stay safe, practice social distancing, do all the work that you can, and I miss you guys, and I hope to see you soon.